As healthcare grows more and more complex each day, many nurses are deciding to focus their efforts on a particular field. Specialty nursing is filled with challenges and offers the chance to work with new patients from all walks of life. Let's zoom into Boone Health to learn what it's like to work in some of the most specialized nursing fields of today.
So the great thing about nursing is that there's so many different pathways that you can go. There is never a day that is the same. And so if you want some variety in what you do, nursing really is that career.
I was a pretty good student in school, but when I graduated, like a lot of kids, I didn't know what to do. I applied for a position at a local hospital in the housekeeping department. And so I was just cleaning up the floors that I was assigned to along the way. And during that time, I quickly became an orderly in the operating room. And that's where I got to see surgery for the first time. Then I became an anesthesia tech, which helps out anesthesia and all their supplies. And then I became a patient care tech on an oncology floor, traveled the country as a scrub tech, went all over the country. Then I decided to be a nurse, went to nursing school. And now that I'm here, I've been a nurse here, and Boone has actually trained me and certified me under Boone to be an RN First Assist here. My primary job here is working with the cardiothoracic surgeons, taking vein for coronary artery bypass graft. And so I remove the vein out of your leg, and then we bypass the blockage in your heart with that vein. My advice for somebody who's interested in the OR is to see if they can somehow come in and see surgeries performed first, get an idea of what it's like, because it's very technical. We have a lot of instrumentation, we have a lot of machines, we have a lot of things that we do in the OR that are not anywhere else in the hospital. So just getting an idea of how the flow of surgery works would be great.
Being a high school student, you can never start finding experiences in healthcare soon enough. Hospitals like ours at Boone Hospital Center provide shadowing opportunities so that if you're interested in something, come check it out.
So I did a medical assistant program. It was about a 1-year program. I was able to get a certificate, and I worked for a number of years doing that. And then while I worked there, I was able to start completing some of the classes for nursing school. I decided to do nursing because I really enjoyed what I was doing with patients. We have people come in with a stroke that has just changed their life, or a cancer diagnosis that has changed their whole life. And we deal with some really serious situations, as does the whole hospital. But what I really like about that is you really get to know the patient, and you're making such a big difference in their lives because this is such a huge thing that they're going through. Yeah, I think when you're in high school, any clubs or associations that you could be in are good because, for one, it'll help build a structure and give you responsibility. So it'll help prepare you some for that, but it'll also help build communication skills too, which is super important with patients, their families, providers, just everyone that you're in the hospital with.
So communication can go in so many different directions. You have to be able to communicate to doctors and to other professionals and really advocate for patients to make sure that they have what they need to get well. And so there's a lot of clinical knowledge and critical thinking skills that also go along with what you need as being a nurse. But I really feel that communication is something that is paramount for being successful as a nurse.
I started out real early in healthcare and environmental services, or to oversimplify the job, housekeeping. Got into patient transport, got to deal with some codes and some of the more exciting, if you will, or challenging situations. And that kind of pushed me into the emergency medical realm. I got my EMT license, got my paramedic license, and worked there for about 4.5, 5 years, and then advanced from there into an interest in nursing. So emergency room just came naturally to me because of the background in emergency medicine. The classes or courses I would recommend to anybody interested in healthcare would be a strong background in science, biology related, anatomy, physiology, but having that strong science background helped significantly. If I had one recommendation to a high school student, would be to get a job in the hospital and just see what it's about. Starting out here and being able to see what the different careers do, what the different jobs do, would help provide some direction, whether that's going into nursing or going into any healthcare career. What makes nursing so wonderful for me is that I have an opportunity to do various things. I can apply the nursing background. I can apply my critical thinking skills. That's what keeps me here in the nursing field, is the advancement opportunities, the lifelong learning, the job security. All of those things are great to have.
So advice for those of you that are looking to go into leadership, particularly in nursing. And I would say leadership happens at all levels, but get involved now. So as a high school student, you can become active in clubs or committees or sports, or being able to lead groups of people, whether that's an informal leader or an actual formal leader. Those are all really great skill sets that are needed to become a professional leader in the future.
So one of my mom's friends worked at the Mexico Veterans Home, a nursing home for our veterans, and she got me a job there. And I just fell in love with it. I fell in love with taking care of those guys. I applied at Breast Rehab and was accepted. I became a tech there. From there, I knew I wanted to continue my career in nursing. I went to LPN school. I worked as an LPN for about 3 years and decided to go on for my RN. I got my RN and immediately applied at Boone and got hired. I chose my position. I always love being a nurse, and I love taking care of patients. So I've always wanted to, work my way up in leadership, just to be able to not only make a difference with the patients, but also, help make a difference with the staff as well. To become an ICU nurse, I think you have to know this is what you want to do. It's very fast-paced at times. I think you need to know that you can handle, those big stressors and stuff.
Nurses make an impact in our community in so many different ways. You can work in a hospital setting. You can work in a home care and hospice setting. You can work in a school setting. So many of you in high school, you've probably touched a nurse, right? They've been there for you, whether you've been sick or you had questions. So every single individual in the community, at one time in their life, has been touched by a nurse. And that's why it's so important, because nurses are there from the beginning of life to the end of life. And that's how we benefit and support our community.
It's great to see inside Boone Health. And, we have actually with us today is Monica Smith, Chief Operating Officer and Chief Nursing Officer at Boone Health. I want to turn it over to you, Monica, and thank you for joining us live for Healthcare Career Day. And I think Monica is zooming in. As she pulls in, if you have any questions, please put them in the Q&A feature of Zoom. Make sure you put your high school, middle school, elementary school name first so we could call you out, as well as the question. And then if you're joining us live on Facebook, please share your question in the comment. And don't forget to share out live our Facebook feed so more of your friends can join us and see inside Missouri Healthcare. Hi, Monica.
Hi, Brian. Thank you so much for allowing us the opportunity to be here today, especially being able to share about my passion as a registered nurse. So as Brian mentioned, I'm the Chief Operating Officer and Chief Nursing Officer at Boone Health. Boone Health is located in Columbia, Missouri, right in the heart of Missouri. And we are not only just a hospital, but we also have home care and hospice, and also a very large medical group. So a lot of great opportunities throughout Boone Health, and I'm just thrilled to represent that. I do want to share one quick fun fact about Boone Health. We actually just celebrated our 100th year anniversary. So think of that, 100 years ago, Boone Hospital actually was built. And the reason it was built, believe it or not, 100 years ago, there was a Spanish flu pandemic. So think forward today, Now we're dealing with another pandemic, so 100 years later. So I just thought I'd share that as a little fun fact. But we're also here today to talk about specialty nursing. And I'm pleased to share that within my own career, I've become a specialty nurse many times. I first started out in critical care or intensive care nursing, and I specialized as a cardiothoracic nurse. So what does that mean? So I took care of patients who came out after open heart surgery and helped them progress through the hospital stay through that. Also in my career, I became a trauma nurse. So I was able to specialize in that area too. And the reason I share that with you today is that there are so many opportunities in healthcare, particularly in nursing, where if you become a specialist in one area, like I mentioned mine, or maybe you want to do emergency department, or maybe you want to take care of cancer patients within an oncology department. There are so many different ways that you can change your pathway through nursing, as well as becoming a specialist and expert in that area. So to me, that's just another great benefit of the nursing profession and those things that we do. So Brian, I think I'd rather make sure that we answer a lot of questions today about nursing because it is such an important aspect of our healthcare system.
Absolutely, Monica. We have some great questions and we're going to go live to a few folks. So we have Jason from Missouri Virtual Academy who's going to join us live. Welcome, Jason.
Hola.
Hi, Jason. Hi.
My question is, what is the hardest part about your job?
Well, that's a great question, Jason. I'm going to break that up into two parts. I'm going to talk about my job right now as Chief Nursing Officer. So I have the honor of being able to serve over 600 nurses within our health system. And so really making sure that I can break down any type of barriers that they're having to make sure that they have a better work environment, that they're able to do those things that they need to do to take care of patients. Because sometimes you can get bogged down with a lot of different things. So that's probably one of the hardest things in my current job is making sure that I provide the support to all of those nurses so that they can provide excellent care. And then as a registered nurse, that's a really hard question, actually. I think nursing is actually really rewarding. There's so many benefits of being able to take care of other people. But you know, there's a lot of responsibility that comes with being a registered nurse. It's making sure that we completely advocate for a patient, making sure that they get their questions answered, that they are able to have education to be able to take care of themselves after they leave a hospital setting. In addition, making sure that we give safe care, right? So we give a lot of medications, we do a lot of procedures on patients, and we want to make sure that we do that in a very, very safe way. So you have to take your job really seriously and make sure that you get the training that you need to do all of those skills. So that would probably be the part of the hardest part, but also a great part of being a registered nurse. Great question. Thank you.
Thank you.
Thanks, Jason. Appreciate you stepping up and zooming in. And we have another question from actually a student in St. Louis at Pattonville High School. Angelise would like to know how much of leadership role does nurse practitioners have in the healthcare space?
Great question, Angelise. I'm glad that you know what a nurse practitioner is. And just for the group, once you have a bachelor's degree in nursing, you can go on and receive a master's degree in nursing, and you can specialize. Again, there's that word specialty. You can specialize as a nurse practitioner. And a nurse practitioner takes care of patients that in combination with a physician, but they also do that independently. So basically, you can look at a nurse practitioner being extremely similar to a physician that gets additional support from that doctor. But as far as being a leader, I would say a nurse practitioner is that kind of the leader of their patients, and they have to be very responsible for managing all of the patient's care throughout their healthcare system. So that's a very important leadership role. I'd also say that we feel that registered nurses are all leaders. We have to be able to be leaders to be able to advocate and provide the best care for patients. So excellent question. Thank you.
Absolutely. And we have another student like to go live. Malia is going to go live and ask a question. Malia, do you want to go ahead and ask your question to Monica? Go ahead and unmute your sound and your video, and please let us know what school you attend.
I'm in the health science program at OTC, and I was wondering if you want to be an oncologist, if you want to shadow, can you just be just shadow in that area? Like, you don't have to go around the whole hospital?
Yeah, great question, Malia, and I want to make sure I heard it. So as far as going into oncology, absolutely. I am a huge advocate for shadow experiences. So any of you who are interested in becoming a healthcare provider, whether that's a physician or a nurse or other fields, take that opportunity, reach out to somebody, but we offer those shadow experiences. So you can definitely just look at doing a shadow experience on an oncology area to be able to learn more about that. And for those of you on the show today, that oncology is about taking care of those patients with cancer. And so being able to identify what that means and what it takes to take care of those type of patients, a shadow experience is the way to go. So great job, Malia.
Yeah, perfect question, Malia. I have a great friend that's in the oncology nursing space, and I'm just amazed every day of what she does to help people go through one of probably the most rockiest times in their life. Monica, as we go ahead and move out, I would like you to just mention, Boone Health has a lot of incentives for nurses going into the field of nursing at Boone Health. Could you just kind of mention a few of those incentives you have there at Boone Health for somebody that would be looking a job there?
You bet. I would love to do that. There's so many different incentives. One incentive is that we are able to provide students with tuition assistance. Also, we do like our nurses who are graduating to have experience in the hospital. So we have experiences as patient care techs, unit secretaries, transporters. There's so many different jobs that you can do. So those are some of the benefits. We also provide monetary benefits when you do graduate with a bachelor's degree, especially if you've already been an RN. But there's lots of different benefits to becoming a nurse. And then if you do specialize, Boone Health also provides incentives for those to become certified, board certified in your specialty area. So I could go on and on, Brian, but I'm sure I'm at the end of my time. So thank you for that great question.
Absolutely, Monica. And thank you so much for all that you do at Boone Health and all that you do to lead a team of high professional nursing staff to really help us in need when we're at the greatest time of our lives. So with that, we're going to zoom out and go on to our next session. Thank you.
Thank you.